Many states across the country and even other countries are enhancing their efforts on providing comprehensive health education for all students. So we're not alone. Most recently, the Colorado Senate passed a bill to update the sex education curriculum for school districts, adding instruction on sexual orientation, consent, and sexually transmitted diseases. The federal government is supporting comprehensive sexual health education through the proposed bill's Real Education for Healthy Youth Act and the Youth Access to Sexual Health Services Act. Additionally, Great Britain is expanding sex education with the guiding principles of keeping children safe, fostering respect for others, and for differences. However, California is leading the way in providing health education to all students and providing support for our teachers and administrators in providing high-quality health education. Last year, California designated $5 million in Proposition 98 funds to provide professional learning and resources for teachers and administrators based on the draft health education framework. Through this effort, health educators across the state have been collaborating on the development of these professional learning tools and resources based on the draft health education framework, and we thank our partners at the Orange County Department of Education for leading this work. And in 2020, we will conduct the state-level K-8 instructional materials adoption process to support districts in their own choosing of instructional materials. And based on state board action today, we will begin the editing and design of the health education framework. So after listening to and hearing public comment regarding specific resources over the past several months, the California Department of Education recommends that the State Board adopt the draft 2019 Health Education Framework for California Public Schools, kindergarten through grade 12, with the changes recommended by the IQC on March 28, 2019, and the removal from the framework of references to the following specific resources: My Princess Boy, Who Are You? The Kid's Guide to Gender Identity, Changing You, A Guide to Body Changes and Sexuality, What's Happening to My Body, SEX, the All You Need to Know Progressive Sexuality Guide to Get You Through Your Teens and 20s. The CDE further recommends that the State Board authorize CDE staff, pending State Board Executive Director approval of final revisions requested by the State Board, correction of any typographical errors, and any non-substantive technical edits necessary for publication. The above resources that I mentioned will be available on the CDE website for any references for our teachers and administrators.
And I would like to see if our liaison, Feliza, has comments at this point.
I do. Thank you. I want to begin by stating that our students are the school system's greatest asset. I believe that all our students deserve to be honored, respected, and properly educated in welcoming, inclusive, and responsive school environments. Every classroom should be a safe, healthy place for students to learn and thrive. Every student should have access to the knowledge and skills they need to grow into a happy, healthy adult. Making sure our teachers are guided towards health instruction that is age-appropriate, medically accurate, and inclusive of all learners is the right thing to do. Given that, I appreciate the hard work of staff, the Health Subject Matter Committee, framework writers, and the IQC in developing this comprehensive and inclusive framework. Besides sexual education and gender identity, this framework includes things like obesity, violence, drug abuse, trauma, health disparities, how those disparities impact communities, and in particular, communities of color and low-income communities. The framework teaches about consent, the growing issue of sex trafficking, and diseases that are real threats that confront today's youth. And it puts their success in life and school at risk, these threats. Equipping our students with the tools they need to protect themselves from these challenges requires honesty, accuracy, and thoroughness. It's still important to emphasize that this framework is not mandatory. The standards are optional as well. The framework is not a curriculum. It's a guidance for districts and teachers as they develop a health education curriculum that suits their local community. In our direction to staff and the IQC, we requested that the framework include resources that districts or teachers can use when partnering with their local communities. As a result, there are references to books, videos, worksheets, and curriculum throughout all the sections of the framework. Unfortunately, a few of the books have generated a lot of misinformation and controversy. This has taken the focus away from very important areas of the framework. Misinformation about these books has created panic that California is mandating the use of certain books, which is not true. The proposed motion removes some of the books that have created distraction and contention. It is important to note that the board is not trying to ban books. We're not saying that the books are bad, but the removal will help avoid the misunderstanding that California is mandating the use of these books. I look forward to hearing from our stakeholders and their respectful public comment. Thank you.
Good afternoon. I'm Mary Perry. I'm Vice President for Education for the California State PTA. Our organization represents 750,000 members throughout the state. Half of our units are in Title I schools. And we support the adoption of this framework as presented and its approach specifically related to gender identity. Research shows that LGBTQ+ youth are more likely to be the victims of bullying and harassment, which has negative impacts on their educational experiences, but also on many, many other aspects of their life. Research also shows that education about those issues, about sexual orientation and gender identity and expression in a school setting has a positive impact for all students in terms of their respect for diversity. This framework is consistent with the department's goal of providing guidance, not mandates, and we urge your adoption.
Good afternoon, Madam President and Board. I am Kathy Hall. I'm the health advocate for the California State PTA. Our tagline, "Every child, one voice," indicates our support for diversity and inclusion so that every child is best served by public institutions. In 2015, our members at our statewide convention adopted a resolution, LGBTQ Youth Plus Health Education in California. Our members adopted HIV, STD prevention education in schools. The framework supports the ideas and ideals in these resolutions. School health classes are the one place where the curriculum is focused on the student themselves. The framework addresses many aspects of youth health and sexuality, gives students age-appropriate, medically accurate information that students can use to act responsibly, prevent disease and pregnancy, and affirm sexual orientation and gender.
Time.
California, we support. Thank you.
I'd like to highlight 4 themes prevalent in the public comment we received during this process. First, we received many comments in support of the framework highlighting the inclusivity of the document. Other themes include the California Healthy Youth Act and parental opt-out, religious diversity, and language choices. As I mentioned, much of the public comment we received was focused on the California Healthy Youth Act, also referred to as AB 329. I'd like to provide clarification on the differences between the California Healthy Youth Act and the Health Education Framework, as I believe there is misinformation that may be confusing for some. The California Healthy Youth Act is a law that took effect in January 2016. This law requires school districts throughout the state to provide students with comprehensive sexual health education, along with information about HIV prevention, at least once in high school and once in middle school. The state legislation also allows districts to offer age-appropriate sexual health education in earlier grades if they choose to do so. But parents can opt out of comprehensive sexual health education, and local districts choose which curriculum and instructional resources they will use to teach comprehensive sexual health education to their students. The law makes it clear that parents can opt out their children out of comprehensive sex education. According to the language in the California Healthy Youth Act, the legislature recognizes that while parents and guardians overwhelmingly support medically accurate comprehensive sex education, parents and guardians have the ultimate responsibility for imparting values regarding human sexuality to their children. As mentioned above, parents or guardians can excuse their children from lessons about comprehensive sexual health and HIV prevention education, as well as research on student health behaviors and risks. However, as stated in Education Code, the opt-out provision of the California Healthy Youth Act does not apply to instruction or materials outside the context of comprehensive sexual health, including those that may reference gender, gender identity, sexual orientation, discrimination, bullying, relationships, or family. For example, the opt-out rule associated with comprehensive sexual health education would not apply to a social studies lesson on the U.S. Supreme Court's 2015 ruling in favor of same-sex marriage. School districts are required to notify parents and guardians a minimum of 14 days prior to the first day of comprehensive sexual health instruction. To opt out of this instruction, parents, guardians must request in writing that their child not participate in the instruction. If the parent guardian does not request in writing that the child be withheld, the child will attend the instruction.